Good morning, afternoon, evening, everybody. We'll be starting this quarter's HuMEL meeting in just about 1.5 minutes as we wait for the rest of our colleagues to join us. But thanks for popping in, and just give us a minute here. Yeah, and as Chris just highlighted in the chat, if you could please take a moment and introduce yourself in the chat, share your name, organization, your role, relevant activities or regions you're working on, that would be fantastic. And we will start. So I'm really excited to welcome you all to this quarter's HuMEL meeting. It's good to see some many familiar faces and names. For those of you that this is your first meeting, HuMEL is Ideal's learning network for humanitarian monitoring, evaluation, and learning practitioners. My name is Lloyd Banwart. I'm the monitoring, evaluation, and research advisor on the Ideal activity. And a few tech topics quickly. We're all very familiar with Zoom at this point, but I want to encourage you to mute your microphone if you're not speaking, but we will encourage you to unmute to ask questions during the discussion points in today's call. And if your connection allows, please turn on your video. Let us see your face, your surroundings. Adds a really nice human element to it if your bandwidth allows. And lastly, we are recording this meeting. It's being recorded already, so we can share it with our colleagues that are not able to join us at this time. If you have any questions during the meeting, feel free to post them in the chat or to direct message anybody with Ideal after their name. So that is myself, Chris Casper Riggs, and Laura Zilmer. Feel free to direct message us and we'll do our best to provide any tech support. So each HuMEL meeting has a different topic, and each HuMEL meeting is sponsored by a different organization. So today's HuMEL meeting is being sponsored by IBTC, and we are really excited because it's a natural follow-on from our last HuMEL meeting, which Chris is going to post the link to our last HuMEL meeting in the chat. But our last HuMEL meeting was actually on accountability to affected populations. There's some really great content in there on how to set up CRM systems in humanitarian and emergency contexts. And today's meeting really takes that one step further. So when we have that data, we have that information, what does it mean in terms of utilization? And what does it look like when that data is being used by or in part of third-party monitoring? And so today I'm very excited to introduce you to Shafia Powell from IBTCI, who is going to be introducing herself and her team around using these types of data in third-party monitoring. So Shafia is a senior manager at IBTCI. She's involved in TPM or third-party monitoring in Somalia and Yemen, and has a range of experience and is grounded in community organization, grassroots movements in disaster and conflict areas, and versed in participatory, sorry, that word's hard for me on a Thursday morning, participatory approaches and inclusive development. She has 11 years of monitoring, evaluation, research, and learning experience, specializing in monitoring and learning at project and organizational levels. She's worked in the medical and agricultural relief within the West Bank, IDP resettlement in Sri Lanka, food security and resilience in Nepal, post-Ebola recovery in West Africa, and most recently, economic growth in Afghanistan. So she's really run the gamut of really focused critical emergency responses globally. She holds a BA from the University of Wisconsin Madison, go Bucky, and MA in Sustainable International Development from Brandeis University. So with that, I'm really excited to hand it over to Shafia to walk us through today's topics. So Shafia, over to you.
Great, thank you so much. Thank you so much, Lloyd. And thanks to everyone here today. Thank you for joining us. First, I'd like to give a big shout out to the Ideal team. I have to say they are very fun to work with. And if you ever have a chance to collaborate with them, you will not regret it. They're people you actually want to have fun with and hang out with outside of this setting. So thanks, and thanks for being so collaborative. I want to give a big thanks to our BHA, Bureau of Humanitarian Assistance counterparts. We have non-disclosure agreements, and they've helped us navigate that, and they've taken time out of their workday to work with us to make this presentation possible, and we thank them for their support. And of course, a big warm welcome to our audience. We're hoping to tap into your rich experience today and knowledge, and so we want to hear your perspectives. There'll be lots of points within the presentation to do that. I guess I should turn my video on. Hi, I have a face. Hi. Welcome to my home. So great. Okay, next slide, please. Sure, so a little bit about IBTCI. IBTCI has been in business for 34 years. We have a very solid reputation in Merle. Mostly we work with USAID, but we have worked with, the organization previously known as DFID, World Bank, MCC, other actors as well. We're very well known for our TPM, third-party monitoring work, our monitoring and verification work. And you will see, we currently have 3 projects, which we'll talk more about, in Yemen, in Somalia, and in Iraq, right? But we've done this type of work in Syria, Libya, and DRC as well. We have a long-standing relationship with Food for Peace, and we've been a HuMEL provider for Feed the Future as well. We're based in Vienna, Virginia, which is right outside of DC, and we're a large for-profit organization. Next slide. Yeah. And so we're kind of in this very interesting position because we work through our TPM work, we work across sectors. We work in health, protection, food security, shelter and settlement. And so we have this very unique sort of vantage point on implementation. We understand these contexts, and specifically what we understand is beneficiary experiences within these activities. And so today we want to share our findings and beneficiaries' perspectives, specifically related to complaint feedback mechanisms, which I'll call CFM from now on, which is such an integral part of accountability and do no harm within, community, within humanitarian aid. And so we'd like to, next slide, please. We'd like to welcome our guests again, and wherever you are in the world, I hope you're doing well. I hope you're caffeinated. And so please, if you haven't yet, please take a moment to introduce yourselves in the chat feature. Let us know where your project is, and then also let us know if your project interacts with TPM, third-party monitorings at all. Have you guys have it? Have you had a site visit? Have you had this project? Is that something you've experienced, or is this completely new to you? Great. And I guess we can move to the next slide as people, hopefully people can fill that out in the chat feature. Okay, so just a little bit about what we're going to discuss today. I'll give a general overview of what third-party monitoring is. Then I'll talk a little bit about beneficiary awareness of CPM across our portfolios and kind of talk about sort of those differences and what we're seeing. We are very, very lucky today to have 2 presenters from our field offices. We have Abu Kanan Astadi, who's working in Yemen. He's based in Amman right now, Jordan, and he's going to share some findings from focus group discussions that we've conducted in the last year regarding CFM, beneficiary perspectives and whatnot. And he's also just a rich resource. He's been working in that context for quite a long time. So if we have questions, he's great. And then also we have Allison Wittenberg, who's based in Iraq. She's in Erbil at the moment, and she's our deputy chief of party on our Iraq project. She also has extensive experience in Iraq and has, rich understanding of that context and of CFM. And then I'll walk us through lessons learned from our Somalia project. And as I mentioned, we really want to hear from you. You guys are the implementing partners. You also work in USAID. You have very interesting experiences. So there'll be opportunities to share your perspectives and also ask questions at the end of each section. Yeah, great. Great. Okay, third party. Okay, so let's get started with the third party monitoring. And also in the chat feature, for those of you who just came, we're very interested to know if you've worked, if you've collaborated with third-party monitorings, if you've experienced that on your projects as well. Okay, and so for the question to the team, next slide. To all the audience, in your opinion, what is the purpose of third-party monitoring? And feel free, what do you think, why is it used for? Why would USAID hire us? How does this benefit, our activities? And if you can either add that in the chat feature, if you'd like to raise your hand, if you'd like to share that way, that's fine too. External quality check, thank you. Yep, definitely, quality is one of the things we're tracking as well. Accountability, absolutely. Oh, great. Oh, welcome, Catherine. Great. Yep, that's right. Quality is good. Oh, interesting. Anyone else? That's great. Okay, thanks. Independence, yes, having an independent set of eyes out there is absolutely important. Yeah. Reduce the management burden. That's a very interesting point. Reducing the management burden of the team. Great. Objectivity, wonderful, wonderful, great. And so talking about sort of the highest level sort of objectives, informed decision making, excellent, very good. All of this is right. Reduce risk, absolutely. All these things, yes, you're all correct, yes. At the highest level, if you can click please, Chris, on the next part. The highest level, we want to make sure that we're ensuring do no harm, and we're ensuring accountability to the populations to which we serve, right? And I think you're anyone working in the humanitarian aid sector is aware of these principles. Also, next, please. And just as you all said, it's also a complementary tool, right? It's a complementary monitoring tool. It helps us with learning and it helps us with decision making. And those decisions include, as you guys rightly mentioned, decisions around quality improvement, decisions around timing, decisions around scope, all these sort of things, right? And this is especially critical in non-permissive environments where we work. Next slide, please. And so we've seen, I've been with IBTCI only last year, but our field teams have been doing this for quite a long time. They have great expertise. And so from their perspective, they've seen a shift. They've seen a shift in how third-party monitoring is used and how it's viewed, right? In the past, initially it was sort of more of this external sort of audit, maybe policing it, or sort of this was the perception that it was policing. Now we're understanding that this is a very flexible and dynamic tool to use, right? It's complementary to USAID and IP monitoring. These are tough to reach areas, and we're able to provide, as somebody mentioned, independent, sort of objective, outside perspective of this, of activities happening on the ground, of beneficiary perspectives. It also contributes to CLA and adaptive management, right? How do we do that? We have very quick, short feedback loops. So information quickly is given to those who need it, to IPs and to VHA, to our counterparts. Sometimes it acts as an early warning system, right? We're also it's another set of sort of context monitoring. We're able to assess what's going on in the areas in which we work. In some ways, it also builds capacity, and we'll talk a little bit more about how that's happened in CFM in Somalia. That's a good example. And also it strengthens, maybe not so much creates, but it strengthens the relationship between IPs and USAID and our TPM. And I'll talk more about that in detail a little bit more. But I think what I've seen, since coming on these projects is what was the most surprising about TPM for me was realizing that it really creates space for dialogue and learning, because we have this back and forth. We have these discussions around these burning issues, these challenges, and around success stories. And so we'll talk a little more about that as we go on. Great. And if anyone has questions, feel free to throw those in the chat box and we'll address them as they come to. Okay, great. So here's a little bit about what TPM looks like. Here we have, IBTCI TPM work, it's pretty expansive. So our teams have to be extremely dynamic. We work across all sectors. Whatever VHA is working on, we're working on that too. So whether it's food security, nutrition, wash, health, unconditional cash transfers, you know, the list goes on and on. But what this does is this allows us to capture trends that are, you know, sector specific, but also transcend sectors, maybe general implementation channels, you know, challenges or dynamics or contextual dynamics. Also, in terms of sample group, these might look a little different. There's sort of two tiers, right? You have the sample group of which activities are we monitoring, right? And this looks very different from country to country. You know, maybe one country, the BHA's priorities is, you know, based on what percent of the portfolio of the budget is. Maybe in another situation, it's okay, what's the contextual challenges? Is there a drought? Do we need to pay more attention to wash and food? So it changes. And also what's interesting about these projects is it's not only changes maybe from year to year, but also we're able to change it from monitoring cycle to monitoring cycle. And so it's a very adaptable tool, very adaptable and flexible system. In terms of participant selection, we've done, you know, a very great job of achieving, you know, near gender parity. We've also done a really good job of working across ages. And so we get, you know, data from across all these groups. And we'll see, you know, but naturally what we find is, of course, it's a little more challenging because we, when it comes to interviewing IP staff and community members, simply because those positions tend to be held, you know, by men. And in terms of regions and areas, we work everywhere, and that's kind of what IBTC is known for in general. We work in the most challenging non-permissive environments. And, you know, where, for example, on the 3 projects that we'll be presenting today, in Somalia, we're in absolutely every region. In Iraq, we operate wherever IPs operate. And in Yemen, where we recently launched Insight in-person visits in northern Yemen, and we're in the process of registering there. And so if any of you work with IPs who are currently registered with SCOMSHA, you can please give me a call, give me tips, and give me moral support, because we would love to hear some tips on how that worked for you. And then here we have, you know, our monitoring and verification toolbox, right? So these are sort of the techniques we're using, how we use them, to, you know, if we're using focus group discussions, surveys, monitoring observation, these sort of things, checklists. And that's how we triangulate and verify data in that way, right? And so we use, you know, and what's nice about having such a diverse toolbox is that, for example, if the context doesn't permit, you know, for us to use some of these in-person tools, we can quickly pivot. We have lots of other tools that are appropriate for that context. You know, Iraq is doing this really interesting hybrid monitoring of both in-person and remote. Yeah, so you have that. But what I want to say, a little caveat about the data that we're going to be presenting is that, you know, we really need to keep in mind that this is just a snapshot. This is the data that we receive is simply from one visit, which is, you know, 4 to 8 hours, something like that. And so these are not necessarily longitudinal studies or reoccurring monitoring, but these are sort of trends we're seeing across these snapshots. So, and also, and one note about the sample size is that, you know, it may not be representative to the greater activity itself, but we're not going to be discussing the data in that way. We're talking about general trends across beneficiaries. Okay, I think, yeah, thank you. And so one thing I want to say about what TPM offers is it offers this very unique opportunity for learning. It has an immense, you know, potential for capture of lessons learned, for capture of challenges as well. And we want to be able to learn from both. We want to learn from, of course, the best practices and the most innovative techniques, but we also want to learn from our challenges because frankly, they're shared. Many of them are shared, especially when it comes to CFM. And so here I'm talking a little bit about the feedback loops. This is kind of how our Somalia project demonstrates this. And you'll see information going every which way, right? And something I want to talk about is data is shared not just with BHA, it is shared directly with IPs as well, so that they have a chance to they get a chance to use and act upon that data as well. And also the learning is a two-way street. So for example, you'll see our processes have improved over time because of feedback from the IPs. And so one thing, now that I have IPs sitting in one room, we need your feedback. I want to just express this, that your feedback is important. It helps us improve our own processes. And there's ways that we integrate that into our processes. So I'll talk about that on the next slide. But basically this data is used to make, as somebody mentioned in the chat, it's used to help improve management. It's data, it's just complementary data that we are able to use and act upon as we manage our projects as an IP, as we manage it as USAID. Thank you. Yeah. And so here we have, yes. So here's a little, this is very scrubbed down, simplified process. But basically, this is how TPM contributes to evidence-based decision-making. Because the data we're collecting is directly relevant and tailored over time to IP's data needs and to VHA's needs. We're a second set of eyes and ears on the ground, but we're also a communication channel, right? We're a communication channel and a feedback loop between beneficiaries and community members, VHA and IP, right? So we make sure that the right information is available at the right time for the right audience, and that it's and that this information is used and available for course corrections and for improving servicing, as you guys mentioned, quality. So do we need to improve these processes? We monitor for that. We also integrate opportunities for IP feedback, and this is how we do it. So once the data is collected and the reports are submitted, there is always a period for IP feedback and clarification. And also after sort of, let's say, several points throughout the year, we have IP workshops and we have learning events where we identify some of these like ongoing trends or challenges, and we sit and we can sort of collectively problem solve and discuss these issues. Also, I want to say, kind of shout out to HuMEL, our Yemen project. They've also taken it upon themselves to have, this is not a deliverable, but to take it upon themselves to have monthly meetings with IPs to just sort of share challenges and what's going on. Yeah, great. And I want to pause for any questions at this point. I think Lloyd posed a question to the team. If we have any thoughts on what is missing or how we can make it.
Didn't mean to distract you there, Sophia. I'm sorry. I was just trying to open it up to folks to just start thinking about if they wanted to share once you were done with your presentation.
Oh, sure. Yeah, no, this is a great stopping point. Mm-hmm. Great. So the complaint feedback mechanism. So T. Morka raises a good point about complaint feedback mechanisms, how the term complaint can deter people from sharing feedback. And that is true. And we'll get into that. Yeah, definitely. What we found is that the limited understanding of what CFM is has reduced utilization, right? Yeah, that's true. That's great. Okay. Next slide, please. So question to you, how familiar, those of you who have, for example, worked with TPMs, what's your experience been? And has TPM, has it impacted or improved or created challenges in your activities? And feel free to raise your hand or to message or use a chat feature. Yeah.
Well, I have a question for you, Shafia, actually. Mm-hmm. I'm curious, there's been a slight push lately to more trying to focus more on local practitioners or local organizations doing TPM. How has IBTCI come across this in terms of capacity building or partnership or mentorship models? How Has that come up in the context that you'll be presenting today at all?
Yeah, we don't get into it. So all of our, and I'll let actually Abkunan and but you know, all of our local, all of our subcontractors are locals, and you know, for example, in Somalia, we have a very elaborate sort of capacity building, well-developed capacity building approach and management approach to our TPMs. And so there's very frequent feedback loops. There's lots of reviews. We have trainings and refresher trainings and a reporting system, like a report card system. So we've been building capacity of our TPMs for years. And I don't know if Abukanan or Allison has anything else to say about that.
Thanks, Shafi and Lloyd. Yeah, yes, I agree. I mean, when we provide, like formal training and, regular, refreshing training, but to be honest with you, the best, approach I found, over years is the day-to-day engagement. That's really the best in building the capacity. And we noticed that over years, actually. Thanks.
Close relationship, I imagine. Great. Okay, let's move forward then. So complaint feedback mechanism. So here, the next slide. So yeah, so as mentioned, IBTCI works across sectors, regions, demographics, and the learning that we'll receive on this project comes from 3 projects. And it's been triangulated over several years. We have 2 presenters, as I mentioned, Abukanan and Allison, who've been with these projects for many years, and they've been tracking sort of these CFM dynamics over time. And so let me just quickly talk about these projects. Currently we have 3 projects, Yemen, Iraq, Somalia. There's many similarities across these 3 projects, but we also have some differences. So for example, some of the similarities is, of course, we have routine monitoring, we're using surveys, we're using direct observation, we're using these different tools. We also have close collaborations with IPs. We conduct data quality assessments as well through this mechanism, but we also have some differences. For example, Somalia conducts focus group discussions at every site. And for example, our Yemen project used to, but we found it was producing the exact same, evidence, the exact same data. So we decided to, save time and resources and cut that portion. So sometimes there's some subtle differences. Also, the schedule is a little bit different. Iraq and Yemen both have an 11 cycle per year cycle. I'm writing this, yeah. 11 monitoring cycles per year, whereas Somalia has 5, right? So because you have quicker feedback loops on those 2, what Somalia did is they integrated flash report systems. So we're able to escalate things quickly if they are emergencies, they warrant that. Yep, we can go on that. Also, one other thing is we also have these options on our projects where we can conduct small scale surveys, other focus group discussions, evaluations if DHA so decides to exercise that. Okay, next slide. Now moving on to CFM, talking about your own projects, I'm curious sort of what CFM methods your activity uses, and you should be getting a poll. Great. And while you're filling that out, I'll go to the next slide. Thank you. Great. And here's the awareness rates from our 3 projects. And what we're finding is, the first thing you'll probably notice about these numbers is that the gender disparity is, common across all 3 countries. And our Yemen project is going to dig into a little bit more of that on sort of these gender differences. And I'll also note that some of these statistics they're not apples to apples, so this is not a direct comparison. For example, the Yemen project, awareness includes, awareness of informal systems, whether it's just talking to a community member or, village elder or something like that, whereas Somalia rates do not. Oh, interesting. Here's the rate. Here's the poll results. So it looks like lots of you have a hotline. Also complaint box. Yep, that's pretty common. Spot checks. I'm surprised at the spot checks. 33% have incorporated spot checks. That's wonderful. And 42 have included an informal system. Excellent. That's a best practice that we found. So we'll discuss that a little bit later. Thank you so much for sharing. Thanks, Chris. Thanks for doing that. Very interesting findings. Great. Very, very good. Okay, great. And so, yep, as you see here, the breakdown between formal and informal. And then in our ROC project, they're measuring more formal, but all of our projects have found informal system to be, quite valuable and more comfortable and more accessible for some communities in some places and some demographics. Great. And so now I'll hand this off. I'll hand this off and let's get a little bit into the how and why behind these statistics. And first, I would like to introduce Abu Kanan Astadi. Yep, here we go. Thanks. He is the chief of party for our Yemen Monitoring, Evaluation, and Learning project. He has a wide range of experiences spanning from 25 years in academia, IT, business, project management, monitoring, evaluation. And for the last 13 years, he's been working in humanitarian aid, 6 of them in Yemen. He's fluent in English and Arabic and has a working knowledge of Hebrew after working in a wide range of countries. He is a father of 4 very, very adorable children. And he treasures them and still has a good laugh even while dealing with all the challenges of raising them. So Dr. Abu Kanan Astadi, I would love to hand this off to you.
Thanks a lot, Shafia, and good morning and good afternoon for all. And thanks for your time for listening to us, guys. It's Abu Kanan here, and I have also my colleagues. Thanks for giving us the opportunity to talk to you. My colleague, Deputy Chief Party, Dustin Clive, is here also, and hope we can, add value to your conversation. Just following up what Shafia noted, overall, we are 3 years now out of 5 years of project. And why HuMEL prefer, to Yemen monitoring, evaluation, and learning projects. So learning is really a core component of the project, which is relevant to this session. In total, we conduct 264, visit as a ceiling, a site visit. We have different, data collection tools, including beneficiary survey, interviewing community members from the committees actually participating in implementing the interventions, and also the IP field staff, in addition to the observations by monitors and also some documents review we do on site. In addition to these tools for monitoring and verification, we use other tools selectively. And one of them is relevant to our presentation today, which is the focus group discussion. This, based on trends or findings that we are interested to know more about. So that's why we use focus group, to understand, any trend, we find in our data. In addition to that, we conduct data quality assurance and evaluation, not every year, but we conducted the year before, and likely maybe this year also will be another evaluation. And this is good mix actually, because our core, day-to-day work is focused on the site level of the intervention. But we have other tools like the DQA and the evaluation, which bring us, a bit further, at the project level and at the program level to maximize the value added to the IPs. Next, please. Well, now focusing today about focus group discussion, which is mainly about the use. I agree with one of the comments about the using of the complaint and calling it. So let us, use the feedback mechanism or feedback, means or channels, I would say. In the previous years, 2 trends we found actually in our project. One, means for feedback is not available at the sites of many activities visited. And this was less and less over time, which is good. There's a progress about that, which means the IPs really provide and invest, in making these means available on the site of the activities. Another trend we noticed that still about 66% of the beneficiaries surveyed out of good number actually, 3,200 about, beneficiaries, 66% of them, show lack of awareness about the means available. And as Shafia mentioned, that includes everything, even verbal, even informal, you know, they just are not aware, you know, how they can share their feedback. This is significant, actually, a percentage, and also it's like consistent, you know, over months. So that's why this cross-year trends invited for deep understanding of the issue. And that's why there was focus group discussions about understanding the use of available feedback mechanism for beneficiaries, the preferable means, what factors promote or prevent beneficiaries from using such mechanism, and what recommendations the participants have to promote the voice of beneficiaries. So what we will tell guys, you know, is the perspective of the IPs. And we prefer to leave it that way as to open discussion, rather than we just make it as assessment and we give our conclusion of that. We just leave it as, you know, to invite discussion about these findings. I'll share in a second. Now, the focus group actually was 21, including women and men, and across sectors. There were in total there 50 women and 60 men. Let us see together key findings. Next slide, please. Now, about the reasons for not using the feedback mechanism. Starting with satisfaction. Beneficiaries say we are satisfied, so why to think about feedback? And here is the misconception about, like what Shafia said, you know, as if, you know, the feedback mechanism is about complaints. So even if they are satisfied, there's still room, you know, to share, you know, suggestion, whatever. But here's important point actually about, like, not to understand the feedback mechanism as only about complaints, you know, and this is important to make beneficiaries aware of that. Illiteracy. In Yemen in particular, I don't know about other countries, this is very, very high percentage, particularly in the rural areas where most of the interventions are illiterate, simple people. So they are not used actually to this formal, you know, way of sharing feedback, including hotline, including complaint mechanisms. They just didn't get used to such a mechanism, you know, of sharing feedback and complaints. Fear of being identified as complainers, and they are worried about to lose, you know, the assistance they are receiving. Being poor and not having phones. So how they can use hotline numbers available, you know, if they can't have phones. Another thing, guys, you know, just keep about this, is sometimes not only about having phones or not, also the network is in many areas are very poor, you know, to use hotline. Beneficiaries in desperate need of the assistance. So they are preoccupied, you know, with securing their basic needs rather than thinking about complaints and sharing feedback. Lack of confidence in a resolution by the IPs to their problems or complaints. And also a negative experience in the past by themselves or others, that they receive no response or whatever negative experience they have. And these actually factors are shared by both groups, women and men. So let us see some gender-specific feedback about this. Next, please. Like, for example, for female groups in particular, they also added to as limited awareness of available and how to use this feedback mechanism. They are not aware of that. Also, misunderstanding of the feedback mechanism purpose, why it's about, and and here it's important, you know, it's not about complaints, also about improving the way, you know, of the humanitarian intervention. Also relying on others, like a little bit of passiveness, you know, okay, I mean, even if there is something to complain about, why do it myself? Let others do it. Discomfort in communicating with men, particularly when we are talking about very conservative communities, particularly in the rural areas. For men specific, you know, comments about this, cultural factors, particularly in Yemen, that complaint is not polite for somebody try to help you. So when organizations, you know, IPs, you know, try to help you and then you complain about things, culturally, you know, it's perceived as it's not polite. Illiteracy, again, you know, it's one mentioned, you know, as a group. Also, it's a challenge as raised by men. Next slide, please. Now, there was a question about preferred method of communication. And as we see, guys, you know, there are some preferences, like let us say both focus groups, like preferences, for example, of direct verbal communication, like 39% prefer this means, you know, like they talk to the field staff directly or the local communities. So we I mean, IPs need to take this into consideration as, so when we talk about feedback mechanism, if this is a preference, let it be. If we can, for example, document or make it a bit systematic in logging, for example, these verbal, feedback, that's still fine, because it's not needed. I mean, it doesn't need to be just formal, means for feedback. The hotline, using the hotline was next. But among the groups, for example, for women in particular, also we see the preference of the verbal communication, while for many groups, they prefer the hotline. Here is some gender, specific, findings. Now, the reasons for preferring the direct verbal communication, they agreed that easy to explain. Like when they verbally they speak, they can say, whatever, they would like to talk about. So that's why they prefer it. Also suitable for illiterate people. In addition to suitable for beneficiaries that do not have mobile phones. For women in particular, they mention that faster and reliable when they talk to that specific person, that community leader, or at least because this is personal engagement, they at least guarantee, or there's a potential that they will come back to them, rather than just communicating through hotline number to somebody they don't know, or using the complaint box also, it's unknown, In addition, familiarity with the community leaders as they live in the same area. They just get used to talk to them, so they feel more comfort. Next, please. So now preference for hotlines, and here, convenient, easy to explain, again, it's not verbal, and for men free of charge, that's a good factor. And for women, it can be used from home, that's good, and faster response they receive compared with other means. Next, please. Now, the preference for complaint box, for those who selected complaint box as preference, it's the location of the complaint box. They know where is it, so it's easy access for them. Do not have mobile, they themselves, don't have mobile phone, so they have to use it. For men in particular, the complaint box is anonymous. That means there's no fear, if they provide, complaint or something, nobody will, punish them for that. This is just also the wrong perception that there is a punishment here. And that's really important. For women, avoid speaking with men, taking, into consideration that these very conservative communities, well, this is a good point, actually. Next, please. Yeah, so what the beneficiaries advise actually to ensure that their voice is represented, Now for both groups actually, they noted assuring beneficiaries that they will not lose assistance. This is important. This fear, this misconception is important. Targeted awareness campaigns, like to try to improve the understanding of that this is not about complaint. This is not about negativity only. No. It's really the importance of this mechanism in improving actually the intervention and making it more effective, So this is important actually to many of IPs, to be fair, they do it actually, but more focus, in awareness among beneficiaries. Also ensuring IPs to response, which means overall to provide positive experience for those who use feedback mechanism, whatever the mean, This encouraging not only for them, for others also. For women particularly, they noted distributing brochures because they can use the brochure. I mean, if the poster is available on the site, of the activity with the hotline number, or the complaint box is available on the activity site, this is not convenient. If they have the brochure at home with mentioning the hotline number or whatever means, they find they can refer it whenever they need it. Also design the means, to be suitable for illiterate beneficiaries. This is important, particularly among women, because illiteracy among women is higher. For men in particular, assigning an individual who is independent, here objectivity, because they believe this will provide assurance that they will not lose the assistance. And assurance also that there will be response, there will be action about it, rather than when they talk to the IP only. This is the way they approach it. And here again, this is important because it's sort of mistrust here. So it's important that to handle this point. Calling beneficiaries directly. I mean, rather than waiting for the beneficiaries to complain or to provide feedback, call them. Try to find, what they think. So I will stop here, guys. There are more to be said about this. Honestly, it's really interesting, but I will stop here just to give time, for some, questions or queries you would like us to address, and thus then can contribute, please. Back to you, Doug. Thanks.
Great, thank you. Thank you, Abu Kanan. This was great. I see one question in the chat feature that I would like to open to both, either you or Allison, actually. And it's from Shannon Hakeem. Sorry if I'm butchering your last name, but the question is, what are successful ways you have seen systematizing these informal feedback strategies to be able to demonstrate the strategy is being used?
That's a good question. And the most important lesson we learned, guys, across, following up on these issues is there is no any specific way fits all. So our recommendation, our lesson is find out what worked for the community and follow that. Educated community maybe had different, way to be effective. Illiterate, people, when there's community, there's another means. So the best advice here is diversify the means for sharing, feedback by beneficiaries, and make it available for them. As you see, the statistics say, it's almost, equal, almost, there are preferences, but they are equal. So providing all these means for the beneficiaries also contribute to make it effective. So my recommendation about this strategy is one way it doesn't fit, diversify it, and also try to change this misconception about the feedback mechanism. It's not only about complaint. No, it's rather about, how to engage the beneficiaries in making things work better. Thanks.
If I see someone has a hand up, please feel free to unmute yourself.
Thank you so much, Shafia. I just have a question in terms of learnings and experiences in the context where the project doesn't always bring people together in large numbers to be able maybe to use like mobile suggestion boxes. If the project, for example, doesn't have like fixed suggestion boxes, what has been the experience in terms of using the systems, the mechanisms that have been established by the project? I'm trying to bring the picture, or to talk about the picture where maybe the intervention is dealing with water sources, like establishment or rehabilitation of water sources, where people in the community are largely go to the water sources, but they do not meet with the IP staff on a day-to-day basis to be able to use things like suggestion boxes. How has been the experience with others? Which mechanisms, if, for example, there are no hotlines in that context, how have other countries dealt with the issues? Thank you, over.
That's an excellent question. Thank you so much for asking that. And so actually, I'm going to hold that question because Allison is about to present a little bit about that. And so her presentation might answer some of those questions. And then also from the Somalia context, we have a couple examples. So, but I'm going to revisit that question at the end of the presentation. So thank you for that.
Thanks, noted.
Very, very good question. Yeah, great. I think actually we can move to the next slide. Yep, thank you so much. And so actually I would like to introduce our next speaker, who is Allison Wittenberg. She's the Deputy Chief of Party for our Iraq Monitoring Evaluation Project, affectionately known as IMEP. And she's been working in this capacity since 2018. And before working with IMEP, Allison was previously a director of programs for an Iraqi organization for 8 years, based in Baghdad and Erbil. And so she spent 12 years living and working in Iraq. During this time, she managed multiple donor-funded programs, large-scale surveys, assessment across a couple different sectors, from agriculture, civil society, democracy, governance, legislative reform, public health, trade projects, so you get the picture. And Allison received her BA degree from George Mason University in Virginia and her MPA from Rutgers in New Jersey. So Welcome, Allison, and thank you so much for joining us today and being here. It's actually thanks to both our speakers, it's the equivalent of their Friday night. It's Thursday night in where they live. So thank you for taking time, and please take it away.
Thank you, Shafia. Good morning and good afternoon to everyone. So I'll be discussing similar to what Abu Kanan described for the Yemen project, but for the Iraq perspective. So IMEP is in the 5th year of a 5-year project. That's the Iraq Monitoring and Evaluation Project. Each year, we typically have 180 site visits. This being the last year, we have a little less. But in the current methodology, we are working in a hybrid for certain sector sites and a completely remote for others. So while Abu Kanan for the Yemen project, they are still continuing with focus group discussions. We have not conducted focus group discussions since 2020. So we are currently conducting individual beneficiary interviews. So for each activity that we monitor, we interview a minimum of 8 male and 8 female beneficiaries about that activity. As Shafia mentioned, we work on an 11-month monitoring cycle, and similar to the Yemen project, we usually conduct a DQA and a small scale survey within each monitoring cycle. Next slide, please. So just to kind of summarize the discussion on Iraq, I'll be discussing the complaints and response feedback mechanism. So our activity uses CFRM or CRFM. We include the response as part of the entire acronym for the mechanisms. Also, I'll be discussing the methods that we've observed partners generating beneficiary awareness of their mechanisms, and also just lightly dive into the beneficiary preferences of formal and informal, but also dig a little deeper as to the preferences based on location. So whether it is a camp setting or an out of camp setting, and also the urban setting versus a rural setting. And then also just some lessons learned and best practices. And just to kind of echo Abu Kanan's findings that he presented, Iraq shares very similar findings with regards to the utilization and also the awareness levels of beneficiaries. Next slide, please. So to summarize the previous year's findings, which encompass kind of a full year of monitoring, IMEP monitored 1,928 beneficiaries. Of those, 420 reported not being aware of any formal mechanism. As far as formal versus informal, IMEP defines the formal mechanisms probably the same as everyone else, but as hotlines, either toll-free or non-toll-free, complaints and feedback boxes, and help desks. And then the informal mechanisms being direct face-to-face contact with either IP staff or utilizing Muhtars as kind of the go-between between the partners and the community, and also just general community leaders. So of those 420, 45% were males and 55% were females that were unaware, which is very similar findings to the Yemen project. And next slide, please. So some of the methods that we have documented of IPs generating beneficiary awareness of the mechanisms have been typically posters and banners, informational cards, so business cards that list the phone number, the email address, just general ways to contact the partner staff. In addition to stickers, which can be affixed to NFIs, so any kind of NFI distribution, a sticker that lists the organization and the phone number, and then just very, very brief instructions on how to provide feedback or complaints. In addition to verbal instructions that kind of complement either distribution of an informational card, and these are typically seen at cash or NFI distributions or healthcare consultations at where beneficiaries might visit a PHCC or an MMU, also protection centers or HCIM community centers where there would be more, individual face-to-face contact with beneficiaries on a one-on-one level, where a one-to-one level, where there might be a waiting area for, beneficiaries to receive assistance. And it's a good opportunity for partners to kind of verbally explain the different mechanisms to use for complaints and feedback. Let's see, next slide, please. Okay, so as I mentioned, IMEP has observed and kind of documented some findings as with regard to the location of the beneficiary. So in addition to the gender, which we all see, as kind of having some differences, we've also seen differences in the locations that beneficiaries report awareness and utilization, which kind of go hand in hand. So in the camp environment, IMEP has observed typically more usage and awareness of the different types of mechanisms, all of the mechanisms, as most of the camps typically provide complaints and feedback boxes, hotlines, help desks, mainly because there's usually multiple implementing partners at the camps. So there is just a general opportunity for beneficiaries to become more aware of any types of these mechanisms, whether it be by the implementing partner that we are monitoring, or by another implementing partner that's currently working in the camp. And that's obviously a benefit to the partners, as it's more of a closed setting. Typically, a lot of these activities implement monthly distributions or monthly services where it's a continuity. So, beneficiaries will see the same setup every month. So they'll see the same help desk. They'll see the complaints box in their day-to-day life. They'll walk by the same poster every day and see the information provided with the hotline provided. So there's a lot more opportunity for awareness and an observation of utilization. So if a beneficiary is able to kind of observe the entire process. So they approach a help desk and they provide their feedback or their complaint, and they first receive the direct, kind of response. They start to buy into the actual procedure. Same thing with the hotline, where they're familiar with the activity, they're familiar with the staff more, and so you see the process unfold. So they call, they receive a call back. They're and they're kind of invested in this process now, and the trust level obviously increases. So that's a big reason why we tend to see less utilization and less awareness in more rural or tribal settings or out of camp environments where there's not a lot of observation of a process, because those activities tend to be either one-offs or there's not a lot of continuity and monthly distribution, or not a lot of the same people or staff that are implementing the project. So it's not as beneficial for beneficiary awareness or to build trust levels in the community. So that's typically where, in the rural and tribal out of camp settings, is where IMEP sees more utilization of Muhtars, community leaders, in submitting complaints, kind of an intermediary that is providing the information to the partners directly. Next slide, please. So some of the best practices and lessons learned that we've collected findings on in the IMEP project are: the distribution of the informational card is a great way to generate beneficiary awareness, but it needs to be complemented with a verbal explanation. As was mentioned with the Yemen project, there are high levels of illiteracy in certain areas. So just handing out a card with no verbal explanation does absolutely nothing. A phone number with some text on it needs to be explained further, and great opportunities for that are seen at PHCCs, where there's consultations, where there's a registration process in the beginning where you must register your name and information, and that's a good opportunity to provide the card with a verbal explanation, because there's already a face-to-face interaction going on there. In addition to beneficiary waiting areas at PHCCs, where there's a lot of beneficiaries gathered at once. And so it's a good opportunity. We typically see a lot of education, health education awareness messages kind of implemented and conducted in these kinds of settings. So, to complement that and provide information on feedback and complaints mechanisms is a good opportunity. Also blanket awareness coverage. So in camp settings, as we mentioned, it's a lot easier to kind of generate awareness as it's the same group, you know, and there's a lot more interaction. It's a closer kind of quarters, closer setting. So in these situations, in order to increase the female awareness levels, you know, 10 to 10 kind of female partner staff reaching out to female beneficiaries is the best ways to do that. And also informing beneficiaries in the non-camp settings, you know, again, we understand it's very difficult in these situations as a lot of female beneficiaries don't have mobile phones and, you know, aren't even in contact with females when the IP staff are implementing, other IP female staff. So, you know, during assessment phases where the entire household is kind of being assessed for, you know, number of members and different kinds of assessment questions there when the questionnaires are being implemented is a good opportunity to reach out to female beneficiaries with the information on beneficiary awareness mechanisms. Okay, next slide. So this is just a photograph of female IP staff disseminating information on hotlines via an informational card in Fallujah Anbar. So again, utilizing female staff to directly engage with female beneficiaries on kind of a household level or, you know, house-to-house level is obviously a very good method to generate awareness. Next slide, please. And then just, you know, this is a typical informational card with a phone number, you know, very largely printed, and then, you know, minimal information on the organization, and then very, you know, brief instructions on how to submit feedback and complaints. Next slide, I think it is Q&A. Frozen.
Yep.
Frozen.
Thanks for that.
Is my audio okay? My video seemed to freeze.
Oh, yep, I'm hearing you loud and clear. Thanks.
Okay, great, thank you. I just saw myself frozen in the corner there. Okay.
Yeah, black screen, so you're all set. Okay, let's pause for questions. You know, a lot was discussed in this last presentation. Thanks. Go ahead, Lloyd.
Oh, your just audio is cutting for a moment. I was going to point you towards there's some excellent questions in the chat box, actually, I think that we can pose at the moment. So the first, and maybe Shafia or Allison, you could help me quarterback who these would go to, but could you maybe elaborate more on monitoring of program itself, progress towards achievement of outputs, outcomes, apart from the community feedback mechanisms? So I think this question from Valentina is really looking at the TPM beyond the feedback mechanisms.
A good question. I think
I can speak for the IMET project. So as far as the monitoring of the program itself, we typically monitor based on indicators that are shared throughout all the activities. Sorry, I'm not sure if it's from what perspective or just in general. Like IMET monitors through the implementing partner representative interviews, through key informant interviews, and then also through beneficiary interviews on targeted questions towards that activity. One of the main focuses are beneficiary perspectives on the activity. So, you know, satisfaction levels, issues, and again, as was mentioned in the beginning, clearly looking for any violations of do no harm and adherence to protection principles. It's just kind of a general overview on our monitoring, separately from the feedback mechanisms.
Shafia, you want us to address this from your perspective?
Please, yeah, please.
Sure. Thanks, guys. Yeah, thanks, Valentina, for the question. Actually, feedback mechanism is only one aspect. So, for example, we have several indicators for monitoring. Feedback mechanism is only one of them. But the rest is really about the implementation itself, not only sticking to the plans or the approved plan with BHA, which is the donor, this is an important component of that, but also checking many other things, which one of them is relating the output achieved to the outcome. So now the question is how, for a TPM that work on the site level, will make that relation. It's questionable, to be honest with you. But what we try to do is looking for proxy indicator that, for example, successful, results, of that implementation, hearing the beneficiaries or stories from the community members, or even sometimes field staff, and observations by monitors. So we try to look for proxies that, yes, these outputs are likely actually leading the project or program in the right direction to achieve their outcome. So as I said, this is questionable because it is not systematic in terms of the sample, in terms of the methodology. But just reminding what the TPM is about, it has a specific mandate. Now, who identify this mandate is the donor, BHA. So this is contractual issues, guys, that we have to address specific issues that of the interest of the BHA, including that if we are in the right direction in terms of the output and the theory of change in relation to the outcome. In addition to this, guys, we have another two mechanism in Yemen, which is the evaluation self, which is at the program level. And this is really excellent, to provide that tool, to address, the program at that level, and also the data quality assurance, which is important that to assess if the reporting about progressing indicators, specific indicators of importance, and many of them, by the way, are outcome indicators, are really leading the project and the humanitarian intervention in the right direction. This is another means. So you see, it's a combination of different means that we are still humble, actually, in addressing these big issues that the TPM try to address. But it's best effort approach. Thanks, Valentina.
That's great. And then I hope that answers the question. And then also from what I've seen as well is, briefly, I'll just say, we've seen situations where we get feedback from the, community that maybe things were not, communication was a little bit spotty. So expectations were different than, what was received or what was implemented. And so being able to highlight that, it lets the IP know, hey, we need to improve communications, we need to better set expectations, and to improve sort of the quality of that portion of implementation. We've seen, feedback on, for example, maybe what's been distributed, for example, food or NFI, maybe it's not sufficient anymore. Maybe there's been, migration. So maybe that community has more people and the need is greater. So all that sort of information is trickled up, and then decisions can be made both on a project level and then also, at a portfolio level as well through BHA. So those are some examples as well. One more question before we move on. Penny, can you please unmute yourself, please?
Okay, thank you. Hi, everyone. My name is Penny. I'm actually joining from Nigeria. I saw on the slide that there were 11 monitoring cycles for the year. I'm interested in finding out how is it like the monthly cycles and how did that work out, because I would assume that sometimes the results didn't really change. And then secondly, I want to find out if the FGD was carried out as a result of, maybe feedback from a quantitative survey, or the FGD is actually the main data correction method that was used. And thirdly, we probably didn't address this at all, but I don't know if anyone has thoughts on how best we can measure knowledge improvement in a program generally, for programs that have to do with training, that beneficiaries being trained on certain topics and measuring their knowledge improvement. Thank you.
Are good questions. I think, Hukanan, are you comfortable answering the first two questions about the program cycle and how the FGDs came about?
Yeah, sure. Thanks, guys. Yeah, it's about, yes, you're right, about trend, the quantitative trends that in our, monitoring, of the visits, of the sitery, and out of the analysis of the data, we find there is a trend. And the trend, both, as I said, one of them is the feedback means are not available in many sites. And this actually, it's over years, because that was a focus, over many years. Actually, there is great progress about this. Almost all IPs investing in this. But the other trends that's still an issue, which is consistently, it's high percentage of beneficiaries reporting that they are not aware of means of to share their feedback. Now it's important here, guys, to differentiate between lack of awareness and lack of interest, because in many occasions that actually it's lack of interest of the IPs. They don't mind as long as the assistance is provided. I mean, they don't, because they have their own priority, and still this is important also as part of the feedback, concept, still, if they prioritize their assistance, we understand, the situation there, but still is important. Now, there's another question, guys, I take the opportunity to address it because it's important, really. It's so what to do? I mean, the question of so what? I mean, out of this, guys, as we noticed, it is not really straightforward issue or straightforward problem that the solution will be just straightforward. No, as we saw that there is like different preferences among beneficiaries, different reasons for not using the feedback mechanism, and different suggestions. So it is a combination of addressing all these issues to a bit, promote the effectiveness of whatever way we want to address this. So it's not like straightforward. I wish that, to be honest with you, that, okay, use hotline and everything will be perfect. It's not, because the way the beneficiaries share their thoughts, their preferences, their reasons of not using it, their suggestions, as you see, it's really complex a bit, So the best way to address this, and again, this is best effort approach also, is to address all what's mentioned, in promoting actually the feedback mechanism. Now, if I go to try to, your question, how we can incorporate this, feedback from programmatic perspective, blah, blah, blah. I'm glad to say, guys, the TPM also is a channel for presenting the voice of beneficiaries. In many occasions, actually, the IP is just good to know about issues or about concerns out of the monitoring reports by the TPM, which is great. This really closed the cycle between the IPs and beneficiaries. And I just speculate why. Because sometimes beneficiaries, they look at the monitors as independent, as we can tell them whatever, we without fear that we lose, the assistance or whatever. So that why there is more openness, there's more objectivity, and that's good by itself, because all this is shared back with the beneficiaries as learned lessons. As Shafia mentioned before, we noticed really a good progress, how the TPM contribute to this cycle of feedback, better programming, which is, I will not say that this is the end, but at least we are in the right direction. So back to you, Shafia, thanks.
I hope that's a great answer, thank you. Yeah, I hope that answers your question. And let's see, I think that's sort of, oh, sorry. Yeah, actually, let's move on to the next section since we're running a little bit late, sorry. I think these questions are great, and I'm hoping we can find another forum to discuss these a little more in depth, because these are great comments and great questions as well. Great, so I'm just gonna move on to the Somalia portion and kind of go through this quickly. What we're finding is, yeah, please keep your questions coming and we'll answer them at the end. So here, this is basically some lessons learned from our Somalia project. And this year is in our final year of its 5th year. We do about 168 site visits per year. And in those site visits, we conduct beneficiary interviews and focus group discussions with beneficiaries. So we get, as Abu Kanan kind of mentioned, this is a nice communication channel through these site visits. It's more spread out monitoring cycles. So we do have sort of an early warning system per se, where we are able to escalate issues quickly. We also conduct small scale surveys and do QAs. Next slide, please. So very high level sort of findings from the previous year, or from this last year, is the year before this last year, we found that, awareness rates were pretty low. And of course, we flagged this. And this was sort of a call to action for IPs where they often doubled down. They improved, sort of doubled down on their efforts to raise awareness. We'll talk a little bit about that. And we did see that improvement from one year to the next. But as we're saying, and this is not a comment on performance, this is more of a comment on the challenge of, in a context like Somalia, getting folks to understand and use formal systems. So what we found is last year at 30% of the sites, we were still finding a lack of awareness of CFM, despite these very intensive best practice efforts. I mean, it would be a situation where, the interviewer is standing in front of a sign, a big billboard saying, here's the number, here's the hotline for the complaint feedback mechanism, and the respondent still isn't aware. So where's the disconnect? How is this working? But an interesting finding was 100% of respondents were aware of an informal system. And this is also contextual, largely contextual. Somalia is more of a clan-based system, and Somali participants, they tend to be more comfortable using these informal systems, such as Builder, Elder, and whatnot. And we've seen that some IPs have been able to integrate this into their formal system. Great. We did a simple case study on hotlines. We found that there was much higher utilization rates for shorter hotlines and lower utilization rates for longer hotlines. And what were some of the reasons behind this? We found that longer hotlines are, and I'm sorry, just to make sure that everyone understands, longer hotlines are sort of the traditional, however many digit numbers for that region. Shorter hotlines are special hotlines that have only 3 to 4 digits, right? So these longer ones, they were more difficult to remember. These beneficiaries receive quite a lot of information and it just gets lost, We also found that using those longer hotlines can incur costs. And so we know that any kind of cost can be prohibitive for usage. But the upside of longer hotlines is, at least in the Somalia context, they're much easier to procure for IPs. It's easier process. The shorter hotlines, of course, as mentioned, they have higher utilization rates. They're much easier to remember. And both of those things apply to hard to reach groups. So especially women and minorities, elderly, disabled, it's really gonna help you reach those groups, right? But the challenge is for IPs, of course, is sometimes very difficult, almost impossible to procure in certain time zones, right? But we do recommend this as a best practice. If you are able to procure a short hotline, it will improve your utilization rates. Great. And next slide, please. And some high-level recommendations from Somalia is, and this actually goes back to the previous question, how do we reach, people, especially in activities where, you might have large distributions, but at orientation, you only have a few beneficiaries. And so now you're meeting people for the first time during distribution or something like that, that type of a situation. So what we found is if you integrate CFM awareness activities throughout implementation, that improves it. What does that mean? That means, okay, sure, you have the initial orientation, sensitization, but again, during distribution, again, during follow-up, again, during these points, there are always, anytime you have a point of contact, a contact with beneficiaries is also an opportunity to raise awareness, right? In addition to that, you can be proactive. So you can actually put resources into making house visits and doing sort of these checks. Also, you can call or use text to sort of to push that information out. Some IPs are employing a spot check system, and we found that this is useful to engage these participants and to collect feedback. And then it's also, again, another opportunity to promote the CFM mechanism as well. And of course, as mentioned, it's those short, easy to use hotlines, easy to remember hotlines. They're really going to help increase utilization among hard to reach groups. And so that's it. We're short on time, so I'll just jump to the question and answer here. And would people
Shafia, sorry, I think we actually have to move on to the next section. But if everyone, because we did want to give some time to share this tool that's been created, but if anyone has questions for our presenters, please still continue to put them in the chat. And we are going to try and compile all the different answers and questions into a document that we'll share in the coming weeks. So before I hand it over, I do just want to say a big thank you to Shafia and Allison and Abu Kanan for putting all this together. It was really informative, and they did a really great job. So I just wanted
I'd like to
say,
just take 1 second to thank our Somalia
Yeah.
team. They were not able to have a presenter here today, but they did great work and good work around learning, and they helped.
Great. Thank you. Really, it was a fantastic presentation. So please keep questions coming, but I'm going to hand it over to Catherine Armeyer, who is going to be introducing the multi-purpose cache assistance toolkit.
Thanks so much, Chris, and fantastic presentation on the third-party monitoring. Thank you so much for that. I think we all learned a lot. I'm going to go ahead and share my screen, and as Chris mentioned, I'll talk a little bit about a multi-agency initiative to develop monitoring and evaluation tools for multi-purpose cache program. All right, great. So wanted to just take a few minutes to introduce you all to a new toolkit that we're very excited about. It is now posted on the FSN webpage so that everyone can have access to it. This is intended to be a living web page. We will be updating the tools on a routine basis to reflect any additional changes based on lessons learned and continuous piloting of these various tools. So we really encourage you to go there, take a look, use any tools that might be useful to your respective programs. So this multi-purpose cache meal initiative, just to kind of talk through a little bit of the basics and the main people involved, it started out initially as sort of a Save the Children initiative, but it's really morphed into a multi-agency toolkit, which has been very, very exciting. From the Save the Children side, a number of people have participated in a very substantial way. Myself, I'm the lead meal person for humanitarian monitoring, evaluation, and research at Save the Children based in our DC office. My colleague Kandil Katak, who's also on the line, our cache colleague Nick Anderson. At Mercy Corps, several colleagues have been involved, Alex Tran, Amy Joyce. And then at International Rescue Committee, we've had a lot of involvement from Simon Fuchs, and one of the tools in the toolkit is actually from IRC directly. And then we've had a ton of interaction with other agencies and feedback from them. So I want to just, before we get started, really acknowledge all the contributions across a number of different partner agencies. So in the next few minutes, I'm just going to talk through 4 different topics. One is the objectives of this toolkit. What was it for? What gap is it meant to fill? I'll just show you the list of different tools and templates so that you have a sense of what's in it. I'll talk through what we've done to date in terms of partner consultations, some of the feedback we've received, and then I'll go through some of the next steps that we have for this. So in terms of the objectives, what we really wanted to do through this work is to develop a set of tools that focus on really core, common, standard elements of conducting monitoring and evaluation for multi-purpose cache programs. So it's not trying to capture everything that could possibly happen on a cache program, but rather each of the core elements that we know happens across the vast majority of multi-purpose cache programs. And also look at what of those are applicable to a multi-purpose cache program, regardless of what's in the minimum expenditure basket. So maybe it's multi-purpose cache for wash and nutrition and food. Maybe it's for shelter and something else. It doesn't really matter what the sectors are when it comes to these tools. These tools can be used across any sectors for multi-purpose cache. And then the second objective of these tools was to really share examples and instructions on how to translate. You guys might be familiar with the Grand Bargain cache work stream. They've put together a list of outcome indicators specific to multi-purpose cache that are being adopted by a number of different donors and implementers, including USAID BHA, ECHO, WFP, UNHCR, and then on the NGO side, many have sort of committed to adopt these indicators as well and have fed into this process. So we really wanted to support that process and develop tools that are really easy to use and uptake without having to sort of reinvent the wheel or create new questionnaires or guess how to measure these specific indicators. I should also say that we were lucky enough to get a little bit of funding to do this work and to really get some consultations from partners via USAID BHA. They gave us a small global grant to be able to conduct a number of consultations and really make these tools available and finalize them so they're not sort of specific to one agency or one type of program or one country, but rather translatable to many different contexts. So this is the specific list of tools that are in this toolkit. We've got a couple of COBO survey templates. These are great, of course, because they also have built-in functionality for certain difficult indicators so that your teams don't have to do the difficult work of, for example, putting together the questionnaire for food consumption score, figuring out how to score it. The template will actually automatically score a number of these indicators so that it really reduces the burden on the analysis side. So that's the case for the example for the post-distribution monitoring survey. There are a couple of like the ECHO quality indicator, if you guys are aware of that. It's a little bit of a complex index indicator that's made more simplified in this tool. It automatically does some analysis for you. It's sort of a basic package of the questions that you should be asking for post-distribution monitoring, getting to some of those quality issues that were discussed in the previous presentation. And this can also be used a little bit as a form of quality checks as well and accountability checks. We also found that a lot of teams were struggling with how to actually use post-distribution monitoring data, and in many cases weren't necessarily using it for anything other than reporting. So we've put together a report template that really has actionable instructions on how to use the data and how to capture who's reviewed it and who's committing to which actions as a result of the post-distribution monitoring. The third tool is just a basic monitoring evaluation plan template. It's based on the BHA requirements. So it is a little bit donor specific, but it can also be used across any donors. We really think that it captures the key elements of what an M&E plan should be. Similarly, the accountability to affected populations plan is based a lot on the requirements from the donor that helped to fund this work. But again, we feel like the specific elements of it can really be used across a lot of contexts. There's also a feedback tracker template. So again, linkages with the previous presentation. This, of course, is meant to only be used in countries where there's not already a more sophisticated feedback tracking system in place. Most organizations will have that, but this tracker sort of is an offline version for countries or organizations that might not have a sort of sophisticated database already in place. There's also a market monitoring survey for multi-purpose cache that's also built into COBO and can be used in ODK. It's an XLS form, so you can just upload it to your digital data collection platform of choice. For ComCare, it requires a few little tweaks. And then the seventh is a cache data flow map tool. So this sort of helps you plan out your multi-purpose cache programs, really articulates the key moments for monitoring and evaluation support. This is in this package, credit to IRC. They originally developed it and adjusted it according to feedback from other implementers. And then the last piece of it is really specific to the Grand Bargain multi-purpose cache indicators. That one is coming soon because there's been a little bit of a delay with finalizing those Grand Bargain MPCA outcome indicators. So we hope to be able to update that and share that with implementers in the next couple of months. So this is just a quick overview of what we have done. And by we, I'm talking about colleagues from Save the Children, from IRC, from Mercy Corps, as well as many, many, many other implementers, and even some local organizations that have fed into this process. So we've piloted now, 3 different organizations have actually piloted these tools between 2019 and today. We've, as mentioned, gotten some funding to help support and share these tools. We have an advisory committee that includes members of the Grand Bargain Cache workstream to really help us shape the tools and make sure that they're as useful as possible to a number of different agencies. We've also held partner calls. We've held them in English and Spanish at first, and we've held a number of other partner calls just in English as well, but with an option for Spanish if people express that through email that they would like to have that. We asked for feedback on all of these tools, and we received more than 350 different comments and suggestions. And we were able to respond to each of those comments, saying whether we had incorporated them, which was the case for most of the comments, or whether we weren't able to incorporate and why. But we responded to every single feedback point from every organization. So we now have this final draft of tools, which is available via the link that Chris has shared, and we're really excited about that. So my last slide is just with next steps. So we're sharing the tools today with you all. We're sharing you the link to the tools. We have a lessons learned workshop with across the 3 different agencies, Save the Children, Mercy Corps, and IRC, who actually piloted these tools in country offices. This is a discussion with the program colleagues themselves around what worked, what didn't, what do we need to continue to tweak. We'll do a very final update to the tools and update them on the FSN page. And then we'll release the baseline endline survey questionnaire in Kobo once we get those final indicators from the Grand Bargain Cash Workstream team. And then lastly, we'll be sharing some guidance notes on how exactly to use the tools. The tools themselves are available now. Anyone can use them if they want, but we'll have some additional very short instructions if that's helpful to folks. So that's it. I know we're about at time. Well, we are at time, so wanted to say thank you all, and please let me know if you have any questions whatsoever.
Thanks, Catherine. And yeah, my deep apologies. We are running just a hair over, and I like to respect time, so we understand if you need to drop. I'm going to take just about 3 to 4 more minutes on 2 more topics I want to highlight very, very briefly for the next set of HuMEL meetings. One is I wanted to highlight for all of you working in the humanitarian sector that there is a new associate award under IDEAL that started officially on October 1st, titled, we're calling it HIAC, Humanitarian Assistance Evidence Cycle. And it's really working to improve the enabling environment around impact evaluations in targeted contextual environments for humanitarian and emergency responses. We're looking at both the supply and the demand side. So the supply of researchers willing and able to do impact evaluations, and the demand of IPs and donors to see the value in targeted, cost-effective and timely impact evaluations. It's a consortium of Save the Children, Causal Design, Tango International, and 3IE. I encourage you to email me with any questions. I am the activity director for the HIAC Award. You will get more information on this shortly in emails and elsewhere. So Chris, you could just move on through the slides. I think we'll expedite through the other ones. Lastly, I also wanted to highlight that there is another community of practice around monitoring and evaluation titled QualMe. It's for qualitative M&E. The next meeting is on March 3rd. We encourage you to sign up to participate. The next topic specifically is looking at the decision-making criteria around qualitative study design and the decisions that go into making those designs. We're actually still looking for a presenter from the Latin America or African context. So if you've implemented a qualitative study as part of a humanitarian award, we encourage you to email IDEAL. I'll drop, maybe my colleague Chris or Laura can drop my email in the chat. But please email me, and it's a light lift, 10 minutes. We'd love you to just share your context and your experience if you're implementing qualitative studies in those contexts. So I'm going to wrap up for the day. Lastly, we are M&E folks. We have a quick evaluation. If you have the time, please click on it. It takes about 60 seconds to complete. And the very, very last thing I'd like to say is I just want to extend my deepest gratitude to Chris Casper-Riggs. He has been working the magic behind the scene of HuMEL for the last 3 years now. And Chris and Kaizan are moving on from IDEAL. Very sad to say from my end, because we've had such a fantastic working relationship with Chris. So this is going to be Chris's last official HuMEL meeting. Maybe we'll see him pop in and visit once in a while in future ones on the participant side. But I just want to take a moment to express IDEAL's gratitude to Chris and the community's gratitude to Chris for everything he has done. And with that, thank you all. We look forward to chatting with you in 3 months about our next topic, TBD. Have a great rest of your Thursday and Friday.